30 African countries, that is more than half the continent, are now treating nearly 400 patients with coronavirus after Tanzania, Liberia, Benin, Gabon and Somalia said they had registered their first cases. Africa had until recently been spared of the rapid spread of COVID-19, which has affected at least 180,000 people worldwide and cost over 7,000 deaths. But health experts are concerned the continent's often dilapidated health infrastructure will struggle to cope as cases mount. Chinese billionaire and Alibaba co-founder Jack Ma pledged to donate over 1 million coronavirus tests kits to Africa on Monday, as the World Bank said it had committed $60 million to Kenya to help the country battle the outbreak. To help with this discussion is Professor Fiona Mbaye, Professor of Biomedical Sciences at the Technical University of Kenya. Prof, karibu sana. Thank you so much for joining us today. Let's start with what I just read, especially because, as I have said, Africa had been perceived as, sort of like immune to this coronavirus, but we were proved wrong. 3 cases now in Kenya. Tanzania recorded its first case yesterday. Should we be prepared for a worse situation, Prof?
Absolutely. I think any country anywhere in the world should be prepared. The initial spread of the virus was from China to the Pacific Islands, Southeast Asia, onto Europe and the Americas. And because of global travel, it's important to realize that it is now going to the rest of the world, including Africa, and particularly where we are concerned, Sub-Saharan Africa.
Let's talk about Kenya, for instance.
Absolutely.
Because I understand there's a presser today. Of course, you did hear the National Emergency Response Committee for Coronavirus say that it will be issuing daily briefs. And today we have that presser at 3 p.m. So what should we expect? What is it that you would want the government to address in terms of the safety precautionary measures that we're taking as a country? Because yesterday, the Transport CS, James Macharia, said that, public service vehicles should be disinfecting or washing the vehicles after every trip. Should we enforce this? Should we ensure that this happens for it to be, practical to avert further cases of coronavirus in the country?
Absolutely. I think the fight against coronavirus is now a responsibility of every single Kenyan, young and old. And I think so far the government has instituted measures which are extremely helpful. But we need to have behavior change communication ratcheted up so that every single member of our society is aware of the behaviors that we need to change. These are against our cultural and social practices, but we must do it, and we must do it yesterday so that we can be able to arrest further cases of coronavirus in this country. In addition to that, we have, I think, over the last week or so, the government has led the effort in terms of some of the activities and that individuals should engage in, some of the activities individuals should not engage in, and we can go into some of those details. But above all, sanitization and cleanliness, because if you don't have the virus on your fingers or expel it by sneezing or coughing to somebody else, it's highly unlikely that then it would be propagated. But behavior change communication needs to be increased as much as possible to every single corner of this republic.
Prof, are we looking at a possibility of a lockdown, especially because I remember yesterday Colonel Oguna said we have 20 people who are admitted. Of course, the 3 cases that we know of, 3 suspected cases, and 14 under quarantine. Of course, they're being observed if they're going to test positive for COVID-19. Are we looking at a possible lockdown?
It's difficult to judge whether or not there's a lockdown which is looming. However, the multi-agency team that has been put together by the President of the Republic of Kenya is really working with different arms of government to make those announcements. However, when a lockdown is looming, I think you started off by mentioning that the government is going to give us a daily update. So when a lockdown is looming, I think we are all going to get to know. So I think above all, Kenyans should not panic, but Kenyans should pay attention, and serious attention, to the things that we have been told to do. Keep at least a meter away.
And we are.
We are a meter away. I didn't shake your hand.
Yes, of course. You called it chicken wing?
It's called the chicken wing, especially for young people. So tell them to do a chicken wing and cough and sneeze into the chicken wing.
Sure.
And then also there are other things that we have seen everywhere. When I came into your studios, it's good to see that you have the sanitizers in place,
Indeed.
hand washing, and these are the psychological things that we need to have in place with respect to behavior change. Are we communicating that to all members of our society? I think we could improve that.
Let's talk about some of the lessons that we can draw from two countries, China, Italy. China, because it has been praised as one of the nations that has been able to manage this situation, and Italy, which has been a global case study of how not to tackle the pandemic. If I could just mention, the country did record new, 368 cases of coronavirus in 24 hours. What lessons can we pick from these two countries?
The lessons that we should pick is the view that we initially had of China. China does things that most countries wouldn't, shouldn't, or can't dare to do. So that is perhaps one of the reasons. China has gone to about 29 new cases per day, whereas the global new cases is about 13,000. And this is within 3 months of getting the coronavirus. So China did everything. They threw everything, including the kitchen sink, at this virus. But some of the things they were doing, other countries, for example, in Italy and other areas of Europe, and in other democracies, it's highly unlikely that those governments would get away with it. That said, we are in a position to learn those lessons that China was successful at and those that they failed at. So if China was able to contain specific communities in a specific time frame, then those are things we should be careful about. And as you see in Kenya, because you mentioned about the possibility of a lockdown, we know the steps that China went through, so we can see it coming.
Yes.
And so when you see what some of the things the government is doing, it's because they've seen the approach that China took. I have to explain something earlier on. While it was in Wuhan, it was an epidemic. The moment it crossed geographical boundaries, it became a pandemic. And now it is a pandemic in Europe, and you can see the
Which
increase.
is now the epicenter. Actually.
Absolutely, it's the epicenter, and now you can see increases and such in sub-Saharan Africa in particular. At the moment, we have few people who are testing positive in Africa. It has been detected. So we still have that very small window to do the best that we can to avoid that huge ballooning of new cases, which are associated, of course, with mortality.
What is Italy doing wrong, or what did it do wrong, recording 368 cases in 24 hours?
I think for Italy, it's not necessarily what they did wrong or what they failed to do. It's the systems of public health care in Italy. So one of the issues that has come up everywhere is the testing. What do you need to be able to go to be tested, and what are the requirements for testing? Do you go in when you have flu-like symptoms, or do you go in when you have advanced respiratory or problems with your chest? So at which point do you actually have the testing to confirm that you have coronavirus, at which point you are isolated? Do you go in? And Italy has one of the best public healthcare systems in the world. So I think perhaps, I wouldn't say for sure, they were comfortable that they would be able to do it because of their healthcare system. But that tells you about how difficult and how quickly this COVID, because it's a disease, it's coronavirus disease, is quick to infect and really be transmitted from an individual to an individual. So I think it was that comfort, and that's why I said China did things other countries wouldn't, shouldn't, or couldn't dare.
Certainly.
Because of the democracy and human rights issues.
Certainly.
Yeah.
Let's now talk about the vaccine.
Yes.
Because the first human trial of the coronavirus vaccine started yesterday. And when we spoke earlier on, you told me the next one is tomorrow.
Tomorrow.
Right? The Wednesday.
Wednesday.
Let's start with debunking some of the myths and misconceptions around this vaccine. For instance, what was doing rounds on social media that people are being paid should be 400,000 shillings to, have the vaccine tested on them. Talk to us about that.
Yes, it's important, and I'm glad you used the word debunking the myths, because we have been actually advised to be careful about information that's doing rounds on social media. So I would advise my fellow Kenyans to be quite careful, and with every bit of information, verify, take it with a pinch of salt. So the 400,000 shillings is highly unlikely. Especially in Kenya. The first vaccine test is in Kaiser Permanente University, Kaiser Permanente Research Institute in the state of Washington in the United States, and they are starting with 45 people, and it is going to be done in a staggered manner, and they're going to start with one individual who got the first vaccine, which is a part of the spike of the protein, and they're going to wait a couple of days before, that is until tomorrow, before they inoculate or inject the second person. It's interesting, I think, to mention that this first person who has been inoculated is female, 43 years old, and a mother of 2. So women are really putting in efforts towards this. The person who's going to have the inoculation tomorrow is male, and not that you're supposed to get differences between men or women, but initially you start with one person and move to another one. This is not normal in vaccine trials. This is extremely far out left field, because in vaccine trials you start with cells which are in a petri dish or a tube. Then you go to animals, and then you try in different animals, small animals all the way to large animals like the monkeys and the like. And then, if you have established safety in these animals, do you cross over and test vaccines in human beings? This is unprecedented, that they're actually trying vaccines out in human beings at the very beginning. They say they expect results within 6 weeks, so we are waiting with bated breath. And with every day, we will be interested in seeing the progress of these individuals, because this hasn't been done. I don't know if you're familiar with the stages of vaccine trials. There is preclinical, where you have the testing done in outside the body on cells. And once you find that those cells don't die or divide like crazy, you put the vaccine in small animals like mice. And then you see if the mice are going to die. And that is called the safety part of this. Once the mice survive, you move on to bigger animals and mammals, because they're closer to the human physiology because of size. And once you move further up, you will then go on to the human trials, which is what has begun in Washington. The plan, of course, they've recruited 45 individuals, so supposedly they've been given the consent and all the things, information on all the things that could go wrong, which is part of clinical trials. So that would be phase 1. Then that is a small number of people, 45, and then phase 2, you start increasing the number of people.
Okay, you said 6 weeks, right?
In about 6 weeks.
In about 6 weeks.
Because that is about the time you start to see the human body mount an immune response that is measurable.
Okay, I think that is important, because Bart had it on social media that it will take months. Some people even saying 14 months.
It would take, to the end of the trial, it would take about 14 months. But initially, the first 6 weeks is, first of all, the question is the protein that they're injecting going to mount an immune response, which is what a vaccine does. You gain immunity against a molecule. So the first 6 weeks we should know, have they gained immunity? And then over a year a lot can happen. What happens during that time? Because as you're aware, many diseases take time to develop and mutate and things like that. So usually it takes a year to 2 years to actually get to the end of the phase 1 clinical trial.
There's a question from one of our viewers, Said Sharif. He's asking, should the vaccine test go well, how long will the vaccine take to be deemed ready, safe and effective for public use? And then he also asks, will the vaccine be affordable for normal wananchi, or will our government take care of that?
So the first thing is the safety. I mentioned the safety studies. Then there's the efficacy. Is it efficacious? Maybe it just succeeds in 5 people. And if it's efficacious in just 5 people, then you don't go ahead with it. So I think we need to make it clear that this vaccine is not yet ready to roll out into the market, that everybody can get immunized tomorrow and avoid the current crisis. So we need to actually put that out there. What has happened in the past, especially with the historical HIV information we have, a lot of the medications that reduce the viral load were actually given to countries such as Kenya through grants and Global Fund to help support our government. I'm not sure what the government is thinking at the moment, but however, what I do know is that at the moment, the government of Kenya is focusing on the prevention and containment of the coronavirus.
Certainly, in under a minute, Prof, is there a cure? We've seen people who have recovered. Is there a cure for COVID-19? In under a minute, please, we need to wrap up.
A cure as in medication?
Yes.
Not that I'm aware of. I think in most cases what we have seen published out there is medications and drugs that have been used to reduce the difficulties that people go through.
Okay, thank you so much, Professor Fiona Mbai there. She is a professor with the Technical University of Kenya, professor of biomedical sciences. Thank you so much, Prof, for joining us today. We do appreciate the insights that we've gotten from